You've got questions, we've got answers.
And I think that makes your pathway to university a lot easier.
The brain,
especially the first year if you pick the right subjects in year 11 and 12.
Information.
Here, and those signals run down through the spine.
Here in our studio, we'll be bringing you the answer to these questions and more. Join us for InfoMate. Assalamu alaikum and welcome back to another episode of InfoMate. One of the common questions asked to dentists and oral health practitioners is, why do my gums bleed? Or my gums bleed all the time? Some of the main contributing factors are our age, where younger people have rates of gum disease of around 2%, while older people aged 65 and over have rates of higher than 50%. Gender, where around 1/4 of the men suffer from the condition, while only 1/5 of women suffer from some form of gum disease. And geography also plays a factor, with people living in remote areas having a higher rate as well. In today's program, we'll be covering in more detail, why do our gums bleed? To help us understand this topic, we are joined here today by Dr. Khalid Jan Khan. Assalamu alaikum and thank you very much for joining us on today's program.
Assalam. Thank you for having me.
Excellent. Now, look, we've had you on the show before and we covered generally some of the tips that people should be looking at to look after their oral hygiene. Yep. Did you want to recap that real quick for us, please?
So basically, what we talked about last time is how the health of the mouth affects the general health. And then basic oral hygiene is part of personal hygiene, and we discuss using various different dental hygiene aids, toothbrushes, toothpaste, floss to basically do the mechanical removal of plaque from teeth and gums and the tongue to promote better oral health and overall general health as well.
Okay.
Yeah.
Now that's a bit of a summary on what we talked about last time. You make sure that you look after your oral health in general,
yes,
and it affects your overall health as well.
Yes.
Now we go to the topic that we've got this program on today is why do our gums bleed? So if I ask you that question as a professional, how would you answer it?
Bleeding gums is a bit of a complex condition to try and answer simply. But we'll start with the basic level, as in the mouth, so locally in the mouth. What happens is you have plaque bacteria, plaque that forms on teeth, and we've discussed that there is in the mouth an existence of over 500 species of bacteria, if not more, that exist or coexist in the mouth and the oral soft tissues. And it is the interaction between the plaque forming on teeth and how the bacteria and the foods people eat and the metabolization, the breakdown of these products in the mouth, that combine that with how the body responds to then when you have bleeding gums happening or gum disease occurring.
So when we're talking about plaque build-up, so what does that look like? What are people looking for there?
So basically you have in anyone's mouth you have like a sticky colorless film that forms, which we call biofilm, and when people eat, the bacteria break down this plaque, and the sticky biofilm helps the plaque stick onto the teeth surfaces, and it's the interaction of it just then depends on over a period of time how the body then reacts if that plaque and that film is left undisturbed in the mouth around the gums, to then the consequence is bleeding gums happening.
So that's one of the causes then,
yes,
is how you look after your general oral health. Is that a contributing factor? We mentioned
yes,
age.
there are other multiple causes. So we talked about the local level initially, and then there are systemic levels as well and other multiple causes. Recapping back to our previous how to maintain oral hygiene. So if you have a poor oral hygiene, you have a increased likelihood of developing bleeding gums. There are other factors such as poor diet, and in particular, if you have a low amount of vitamin C, and that's very important in collagen synthesis for the gums. And in previous histories in World War I time, or sailors in the past that had scurvy, that had vitamin C deficiency, so they developed conditions such as trench mouth and things like that, which affected their gums. So once that was, the vitamin C was addressed, that condition went away.
Okay, so that's related to, say, our diet and our food.
Yes.
Now, if we go back to the first point of plaque, I notice
Yeah.
you've got some images here on the
Yes,
table there.
yeah.
Can we demonstrate to the viewers sort of what we're looking at when we're talking about plaque?
So
in the mouth?
plaque, if I demonstrate on here, it's a pretty clear image of just the upper anterior or upper front teeth and lower front teeth, and you've got plaque stuck on the teeth, but it's a bit visually hard to see
It's a
on
bit
the.
difficult to tell,
It's a bit
isn't it?
difficult to tell. So what I would do sometimes in the chair, in the dental chair, or oral practitioners will do, just to give a visual explanation to people, is to use a disclosing agent or a dye, swished around in the mouth for a few minutes, and that helps visually identify it. So I'll
What does it look
show
like?
you that one. Sorry. So it looks like
Wow,
that.
so that's the same image after we've got some dye
Yes,
attached to
so
it.
we'll compare those two together. So like that. So you
Wow.
can see.
It's a big difference. You can tell clearly now, can't you?
So when we talk about local, in terms of the basics of bleeding gums, that's what I mean by leaving plaque in and around your teeth and gums for a sustained period of time for that reaction to occur.
Okay.
All right.
So that shows the mouth of someone who should practice better oral hygiene.
Better
is it?
oral hygiene, as we identified, as one of the causes, and then poor oral poor diet, along with other certain medical conditions. There can be underlying systemic conditions like hemophilia, von Willebrand's, or uncontrolled diabetes is one of them. If we're talking along these lines, then seek medical and dental professional help to identify these as a possible
So what are
cause.
some of the key diet triggers that you might say, I don't know, do I drink a lot of sugary soft drinks or something like that? Is that what we're talking about when we're looking at diet in particular?
Diet in terms of gum disease has to do with, just for gum disease in specific, it's the vitamins and minerals. So
Okay.
lack of certain vitamins, like I mentioned, vitamin C, as a potential indicator.
Okay.
If levels are low, then there's probably increased likelihood of developing gingivitis, yes. However, in previous stories we talked about sugar and acid, and that's to do with the harder tooth structures, so the enamel, the dentine, and the dissolution or dissolving of those structures.
Okay.
And
So
that's
in this particular case, we're looking more at the vitamin C
yeah.
to make sure you've got good levels of that.
Yes, yes, and also going to the other causes as well, medically, there's genetics plays a part as well. So in terms of gums, there's a specific biotype, we call it. Some people have a very thin biotype of gum, some people have a very thick biotype. So genetics also plays a certain part in when we're talking in the broad scheme of gum diseases, it plays a part as well.
Okay.
Yes.
So when we're talking about bleeding gums, you mentioned gingivitis. Now, is that the first stage? Is that the final stage? What's the process or progression?
Progression, yes. So basically, if left untreated, as I showed you in the picture here,
Yes.
so if left untreated, typically within a period of more than 24 to 48 hours, so in some individuals it can be 24 hours, but some people it can be 48 hours. If left undisturbed like that, as I showed in the photo, then you can have the interaction between that plaque and the bacteria that is in the plaque, and how the body responds is basically the bacteria is left long enough for that period that the body identifies that there's potential invasion of bacteria. So I gotta send a rush of blood, increase blood flow to the area to fight off this bacteria. And so as a result, physiologically, because there's an increased blood flow to the area, typically in any kind of infection or condition in the body in general, when we speak, that's how our body will respond, right?
So it's like the body's natural reaction.
It's a reaction to a sustained period of stimulus or onsult, if you want to call it. And so, yes, so as a consequence of that blood flow trying to ward off this potential bacterial invasion, you have bleeding gums. So, and then it's individual variations there as
Do
to
they
the levels.
bleed on their own, or do they
They
bleed
can.
after brushing your teeth?
They can. it can vary, once again, from different ages, from young to the old. It can vary between men and women. In particular, if we're talking development in general for both genders, for women in particular, one of the potential causes of gingivitis is pregnancy. So there's hormonal changes related to the body. And so the body becomes hyper-responsive to any kind of subtle, even slightly bacterial overload, especially in the mouth, that can have sensitive gums as well as a result. So, and their gums may not bleed, just bleed without, physically touching them.
So you mentioned that it's usually around the 24 to 48 hour period before the body reacts.
Yeah.
So does general brushing help this? You should be brushing every day to get rid of the plaque?
Yeah, so when we talked about the oral hygiene in the last conversation, we said the routine brushing should be at least twice daily, and it should be mechanical removal. So physically get a toothbrush, floss, some kind of aid to put in between the teeth to just disturb the plaque. That was the main theme of that. Having said that, if we're specific to the gum, at least once a day disturbance, and this is thorough cleaning, will help minimize or prevent or reverse the condition. However, it's not same for all individuals.
It depends on the individual circumstances.
It depends on individuals, but as an oral health practitioner, and part of our profession is to promote regular brushing. So twice daily is optimal. Yes, so physical mechanical removal is the key at the end of the day.
Okay, so that's with your bleeding gums. Now, what's the stages? Can you talk us through it? If that was left undisturbed, your body's reacting to that plaque.
Yeah.
You end up with bleeding gums.
Yeah.
Do you know whether your case is minor or major, or is it severe?
So it has to be assessed initially, and there's a lot of factors involved again. It's a multifactorial condition. So it depends on then assessing the levels of bleeding potentially, and then other factors as in going to the dentist and getting your gums looked at. So there are supporting structures to the teeth. So I'll demonstrate on this model here. Okay. So you've got your teeth, which is surrounded by your gums, right? So I'm going to bring another visual aid. And then if we just imagine this as a cross section, you have supporting structures all the way around.
So that's in our jaw. That's what this
that's
is showing.
that's a tooth. So when we saw the tooth here, so like that.
Yep.
So imagine that as a cross section of it. Okay. And so basically you have roots. So you have supporting structures of your teeth and the roots. They include the gums, and the gums have got collagen fibers. They've got ligaments. They've got bone, surrounding bone. So
just like any other part of your body, really.
Just like any other part of the body, yeah. So it's not classified as a joint, but it's got some cushioning and a little bit of normal mobility within its function. So, so when we're talking about gum disease, gingivitis is at a very early stage of gum disease, but it's not classified as it's a reversible condition.
Okay.
When it gets prolonged, you have loss of ligament or infiltration into deeper tissues like ligaments. Your bone starts crumbling or getting affected or reducing in height. That's measured by, we use our probes infiltrate the gums, and just there's a certain classification of how we classify as a mild, moderate or severe. It depends on the level of the pockets, we call it, in the gums.
Understood.
Caused by the destruction of the ligaments and the bone.
So is it the tooth that's getting decayed in this picture?
So it's more the supporting structures.
Okay.
So the tooth then becomes like a foreign object in a sense, where the body is constantly trying to recognize bacterial invasion deeper into the pockets, into the gums, and then tries to keep sending these increased blood flow, the cells to fight off this bacterial infection. And in my kind of case in the public system, I've seen the worst end of it, where it's just, the destruction's so far with the bone that it's quite loose, and ultimately unsavable, but that's at the extreme end
The other
of the
side.
disease condition.
So you mentioned at the start you've got gingivitis, which is reversible. So how
Yes.
do you reverse that?
So brush, disturb the plaque, stick to your routine regular brushing. There are, in terms of specifics, if we're talking the older age groups where there's an increased likelihood of gum disease or periodontitis, we call it, we use certain aids. We talked about flossing,
Yep.
so we demonstrated flossing in between the teeth. We've also got interdental cleaning brushes, so something like that.
Okay, so it's just a little bit of a brush.
It's a little bit of a brush. Most people will be used to toothpicks,
Yep.
which is made of wood, and there's a risk of it splinting if it breaks. Don't know what the quality of the toothpicks are. This is a little bit more safer, in my opinion. It's got a brush end, which you can always reuse and rinse and reuse after a certain point. But basically, this is very useful in going in between the teeth and just pushing any plaque or food and bits that gets caught in there. So this is a bit bigger size for these gaps, but
So
the
is this a
idea
bit-
is to just
Bit
get in
more
between.
advanced than flossing, is it?
It's more dexterous. So for older people in particular,
Yep.
it's a lot more easier to use to clear out food, plaque in between the teeth. Yeah.
So you should be trying to keep that full mouth hygiene. So you should be brushing, flossing,
Yeah.
and then using these picks as well to try
As
and disturb.
additional aids, yeah.
Yeah.
As particularly if you've seen a dentist and you've been diagnosed with a certain level of gum disease or periodontitis. Yeah, having said that, this condition can be stopped and reversed
Yep.
in some instances. So at the end of the day, what doesn't change is the mechanical removal
So
part.
what happens if it's progressed a little bit further and
Yep.
now it's no longer reversible? Is
Yep.
there things that we can do to look at curbing it, stopping it maybe?
If, like as you said, if it's beyond stopping it or can't be reversed, then you assess the prognosis of the tooth or teeth that are involved. Usually, in my experience, they're extracted because due to the fact that there's not much foundation, as in the hard, the bone, and the soft tissue structure supporting the teeth. And people can go without, they can have loose teeth in the mouth and can go without just not extracting them, but high majority of the time it is symptomatic, like it's painful, and it can, the ultimate is to extract it, and treatment options include potential implants or dentures or bridges.
So can it be
things like that.
localized even inside the mouth? You're not talking at all the teeth get affected by gum
It can,
disease?
yeah, it can vary. So it can be localized in some teeth and in some people, and it can be generalized in some people, and it can affect very young people at a general level as well. I've seen people aged around 25 who've had quite significant bone loss and had to do full clearances, as in extract all their teeth
Wow.
because of the condition.
So that's extreme cases.
And that's extreme cases. And the condition of gingivitis and periodontitis / gum disease, that can coexist in the mouth as well. So it can be localized in some areas and it can be general in some areas. So you can have general gingivitis and localized areas of periodontitis. So yeah, it's a mixture. It's a very complex classification.
Yeah, I can understand. We mentioned some of the contributing causes being age and gender and geography even.
Yeah.
So why would older people, is there some sort of science why older people might be more affected by gum disease?
It's a bit difficult to try and specifically answer that question. It's a bit challenging, I will say. Purely the fact that there can be a lot of factors involved. So depends, they've done research into the types of bacteria that can populate the mouth. Once again, genetics plays a part. There are your oral hygiene habits, your diet, stress and depression, psychological conditions these days which increase cortisol levels in your body, has been linked to like unnecessary inflammatory conditions in the body. And these factors, there's a multi-factor, there's a lot of kind
lot
of
of factors
condition.
with the age.
So as you age, yeah, it's
More
a combination.
factors.
Yeah, it's a combination of
understand.
things. Yeah.
And what about the genders where males are more susceptible to gum disease than, say, females?
Yes, it's a tricky one as well, that one. But males, once again, probably, yeah,
Just lifestyle issues.
it's lifestyle. Potentially, there's smoking as well. Smoking is a big topic with gum disease as well. There's a lot more to talk with smoking, so it may be a situation where males smoke more than females, but again, similar subjective, like similar multifactorial factors apply.
So the best method is to identify it through regular visits to your dental practitioners, I guess?
Yes, correct. If you notice like out of no reason your gums start to bleed and it's happening on a regular occurrence, seek medical help and get an awareness or information as to how your gums are. And it's a chronic process. Gingivitis, like I said, reversible. Periodontitis gum disease is a chronic process and it can happen painlessly. In certain situations when you have more deeper pockets forming in the gums, then things can get lodged or dislodged and it can create an acute infection, which is painful. So yeah, seek dental help and then get a diagnosis and based on that follow up with your oral health practitioner as to your routine for therapy.
All right.
Yeah.
I've also noticed we've got a syringe of water here. What
Yeah.
might be the purpose behind that?
So that was another additional aid that I was going to demonstrate to use for cleaning the gums or flushing. We call irrigation. So when we see the patients in the chair, we'll be cleaning their teeth and we'll have water spray with ultrasonic scalers, even use syringes like this to basically engage where the pockets are and just irrigate and flush it out.
Is that something you can do at home?
This is something that I encourage for people who have gum disease to, at least as a mechanical removal of plaque, is to use it at home. They can load it up with mouth rinse if they want, or just clean water as long as it's clean, particularly nightly, and just give it a rinse and flush out so there's no plaque and food that's caught in there, which can, leave, if left there, can cause constant irritation and annoyance to the individual. So yeah,
Just squirt a little bit of water around the teeth? Yeah,
Yeah.
you can go for it, it's all right.
yeah. So we just, hopefully you can see it. Yeah. Oh, sorry.
Yeah.
So yeah, we just do a little bit of flush around, all the way around.
Okay, so you want to
Yeah.
follow that throughout your mouth
Yeah.
if you've got the issues. Probably, is it after the stages of flossing and using the pick? Do it at the end? Doesn't really matter?
There's as long as whatever the sequence an individual decides, as long as they're just actively, physically removing. There's no quick fix, unfortunately, as in rinsing your mouth out with just mouthwash and just letting it be. It's just it requires a lot more attention to your oral hygiene when it comes to gum disease. Yeah.
Oh, excellent. Thank you very much for joining us on today's program. It's been very
No
informative.
No worries. Yeah. Hopefully, we've covered a lot, and we'll keep going.
Thank you.
Jazakallah.
I hope that we have been able to outline why our gums may bleed. Gingivitis is an inflammatory response due to plaque bacteria in the mouth and the body's immune response, but this condition is reversible. Gum disease, however, is an advanced condition resulting from various contributing factors from poor oral hygiene to diet and general health. If you feel you have any concerns, please seek professional advice from your local dentist. Thanks very much for watching, and we look forward to bringing you another episode of InfoMate from MTA International, Australia Studios. Jazakumullah and Khudafis.